Gastric cancer, commonly known as stomach cancer, is a deadly disease that forms when malignant cells develop in the stomach lining. While many associate it with countries like Japan or Korea due to historic prevalence, cases in the United States, Europe, Australia, and India are rising, especially among populations with poor dietary habits, high obesity rates, and growing antibiotic resistance. Unlike cancers that scream, gastric cancer whispers. It begins in the mucosal layer, the stomach's protective inner lining, and often goes unnoticed until it's too late. In the U.S. alone, over 26,500 new cases are expected in 2025, as projected by the American Cancer Society, with survival rates still far too low. Europe sees over 136,000 diagnoses yearly, particularly in eastern countries like Poland and Romania, while Australia is seeing a slow but steady rise in cases tied to aging and alcohol. India faces unique challenges due to high H. pylori prevalence, poor food safety, and delayed diagnostics. What's alarming is that the early symptoms mimic indigestion or acid reflux, making it dangerously easy to ignore. According to Cancer Council Australia, education, regular screening, and lifestyle changes are urgently needed across all demographics. Whether you live in New York, London, Sydney, or Delhi, this is no longer just an Eastern disease. It's everyone's problem. The hidden process: how gastric cancer silently develops in America and Europe. People often assume stomach issues stem from fast food, acid reflux, or stress. But that's precisely the trap gastric cancer sets. It often begins with long-term infection by Helicobacter pylori, a bacterium that's especially common in India and parts of southern Europe. This microbe inflames the stomach lining, creating cellular damage that builds over years, even decades, in Western countries, where ulcer medications and proton pump inhibitors are overused. Many unknowingly suppress symptoms rather than addressing the underlying problem. In Australia and the UK, rising obesity and diets high in processed meat and salt are silently contributing to cellular mutations that lead to cancer. According to the European Journal of Cancer, the time from initial stomach damage to cancer formation averages 10 to 15 years. In rural India, poor sanitation contributes to early H. pylori exposure in childhood, increasing adult risk. Meanwhile, Western diets, filled with red meats and low in antioxidants, make the stomach lining more susceptible to mutation. Modern life fuels the fire, whether through food additives in California, excessive drinking in Germany, or chemical-laden pickles in urban Indian kitchens. It's a slow invasion, and it doesn't discriminate based on passport. Early signs you might be missing right now in America. Over-the-counter acid reducers are a staple. In India, spicy food is often blamed. In Europe, people turn to herbal teas or digestive tablets. But what if those subtle signs, bloating, early satiety, nausea, or fatigue, aren't harmless? Early symptoms of gastric cancer often appear as common discomforts: feeling full too quickly, loss of appetite, mild upper stomach pain, or unexplained weight loss. By the time you experience blood in your stool or vomit, the cancer is often advanced. In Australia, a rising number of patients report mistaking the signs for IBS, irritable bowel syndrome. In India, due to lack of awareness, even serious symptoms are written off as gas. According to a 2024 Mayo Clinic study, most patients ignore signs for over 3 to 6 months, assuming they'll pass. In the UK and US, diagnostic delays are common because general practitioners often don't refer patients to specialists fast enough. Knowing these early symptoms is crucial. They aren't always loud, but they're persistent. If your digestive discomfort doesn't go away in 2 weeks, get a checkup. That could mean endoscopy, H. pylori tests, or even a simple stool occult blood test. It's not paranoia, it's prevention. Your stomach is not just a food processor, it's a warning system. If ignored, gastric cancer doesn't stay confined to the stomach. It spreads fast. In India, patients often arrive at hospitals with stage 3 or 4 cancer because early pain was ignored. In the US and Europe, where diagnostic infrastructure is stronger, the delay often happens at the patient level due to ignorance or fear. Gastric cancer spreads through lymph nodes, the liver, pancreas, and even the lungs. In Australia, studies show a surge in stomach cancer metastasizing to the peritoneum, the lining of the abdominal cavity. When that happens, even aggressive treatment struggles to stop it. The survival rate for metastatic gastric cancer is under 20% across all regions. You might notice fluid in the abdomen, jaundice, severe weight loss, or deep fatigue. According to Johns Hopkins Cancer Center, late-stage stomach cancer also leads to malabsorption and chronic internal bleeding, causing iron deficiency anemia, constant weakness, and in some cases, fainting episodes. India faces a unique challenge. Rural patients rely on home remedies or underqualified practitioners. Meanwhile, Western patients delay due to cost, stigma, or misdiagnosis. Cancer is democratic. It doesn't care if you have Medicare, NHS, or Ayushman Bharat. Once it spreads, you're in a race against time. Thankfully, modern science is catching up. In the US, Europe, and Australia, endoscopy with biopsy is the gold standard. The UK's NHS now offers H. pylori screening for patients with recurring ulcers. In India, top hospitals like AIMS and Apollo now perform laparoscopic staging and PET CT scans to detect early spread. In the past, we relied on barium meals and X-rays, which missed tumors until they were massive. Today, technologies like AI-assisted endoscopic imaging are detecting tumors under 1 centimeter in size. Treatments have also evolved. In Australia, the US, and Europe, immunotherapy, nivolumab, pembrolizumab, is extending lives, especially when combined with chemotherapy. In India, cost-effective surgical options are being combined with targeted therapy drugs like trastuzumab. Recovery takes time, on average 6 months to 2 years, depending on the stage. In Japan, where mass screening is routine, 5-year survival rates exceed 60%, compared to 32% in the US and as low as 20% in India's rural areas. Past treatments often involved full stomach removal. Today, minimally invasive surgery, nutrition planning, and post-treatment monitoring are standard. Diagnostic labs worldwide now recommend CBC, upper endoscopy, CT, PET scans, and CEA, CA19-9 markers. One thing is clear: the earlier you act, better your chances. Preventing gastric cancer. Global measures that save lives. Gastric cancer isn't inevitable. It's preventable. Across the USA, Europe, Australia, and India, the key lies in early detection, gut hygiene, and clean eating habits. Start by screening for H. pylori, especially if you have a family history or frequent stomach issues. In India, affordable eradication therapy is now widely available. In the US and Australia, you can request a urea breath test or stool antigen test during your annual checkup. Diet matters too. Cut back on processed meats, excess salt, alcohol, and sugar. Embrace fiber-rich foods, cruciferous vegetables like broccoli, turmeric, and green tea, all shown to lower gastric cancer risk. Avoid smoking. And if you're over 40 or experience persistent indigestion, ask your doctor for a referral. Prevention isn't just physical, it's cultural. Schools in Japan and South Korea teach children about stomach health from a young age. Why not in New York, London, Sydney, or Mumbai? If you've already faced this disease, frequent monitoring, psychological support, and dietary adjustments are critical. Take your supplements, stay in touch with your doctor, and above all, never ignore your gut again. The consequences of late detection are catastrophic, but the reward of vigilance is life itself. Across 4 continents, We're facing the same enemy. It's time we fought with the same awareness. If you found this video helpful and inspiring, please, darling, hit that subscribe button with love. Let's stud awareness, take action, and fight gastric cancer together.